I would also like to introduce ma'am because she is president of Ozone Forum of India and trustee of Bislady Charitable Trust. She is practicing homeopathy and since 25 years, practicing ozone therapy since 18 years with charitable institutes and hospitals. In fact, she has also conducted 84 training programs of medical applications of ozone therapy in India. And we are looking forward to hear from you, ma'am. Everybody, please give it up for the beautiful lady.
I just want to say something about Mili. Recently, my daughter had a burn on her arm, and it was miserable. And within 6 days, she put some ozone bagging and it's gone.
Yeah. Without scar.
Without a scar.
Thank you, Dr. Sanjay Sachdeva, for inviting me here. Thank you, Dr. Alok Chopra, for inviting. And a very warm thank you to Mr. Arjun Sharma also. Oxygen, ozone therapy, the most forgotten nutrient, right? So we are here to listen about something which we have forgotten and which we really don't pay attention to, which is oxygen. So we talk about nutrition, diet, lifestyle, but the molecule, the most important critical molecule, which also fits into the Oxford Dictionary, what is nutrient is something which gives you growth and which enhances your living, and oxygen fits into that, and we have all forgotten this particular nutrient which can detox you, which can rejuvenate you, and which is life-sustaining and life maintenance. So if I say that if you hold your breath for 3 to 4 minutes, would it be possible? Yes? No? A minute is possible, but not. But you can stay without a nutrient diet without 3 to 4 minutes, right? So what is most important? Oxygen. So just get the focus back to the oxygenation part of it. But before that, I would like to also mention the ozone layer in the atmosphere works as a shield for the harmful ultraviolet rays of the sun. And this makes ozone as a noble gas which works for protecting our Earth universe, and this also converts continuously into oxygen, giving the oxygen-rich atmospheric for us. So this slide, this part of the slide, when you see, it gives you earth maintenance. The oxygen is maintaining your earth. At the same time, this oxygen is maintaining every cell respiration for you. So every time you're breathing, your cell undergoes respiration and it uses oxygen. So oxygen also is very critical to maintain your balance. And how many of you pay attention to our breathing? We are all slouching? Yes? Few of us are sitting erect. We are slouching. When you slouch, how much percentage of your lung you use for breathing? How much? 1/4 capacity of your lung. Your lung has 3 lobes. We are using only upper lobe. Okay, so when you do deep breathing, that's why deep breathing is very important, because you will get the full amount of oxygenation which is required. But we, as in modern lifestyle people, we are not using the full capacity of oxygen. That's why you are using less oxygen for the cellular respiration. That's why you will not have the amount of ATPs, that is ATP, which is an adenosine triphosphate, for you to have a cell currency, for you to have better energy. So this is lacking. At the same time, there is something called lack of oxygen utilization. Okay, now this is a new term. Lack of oxygen utilization means when you are bombarded with pollutants, pesticides, artificial living, or exercising in a closed AC environment. Exercise without having proper water. Dehydration, of course, what Dr. Sakina said is very, very important. We all are cellularly dehydrated. So when you have decreased oxygen utilization, what you get is something called mitochondrial decay. What is mitochondrial? We all know engine, right? For every train or for every car to move, you need engine. For every cell to work, you need mitochondria. And if that mitochondria is not working properly, it is not utilizing oxygen, and you get aging. So there we come, that if you are not breathing enough, or if you're not giving enough oxygen to your body, you get or you are having degenerative diseases and you are having aging which is faster, which is not normal aging, which we call it a pathological aging. So, and this aging is also with ROS, that is reactive oxygen species. So when you don't have proper oxygenation, you develop a molecule in your free radical in your body, something called reactive oxygen species. And, so you will say, what is this reactive oxygen species? Any of you have any of these symptoms? They have this reactive oxygen species. So do you get cramped? Do you feel sleepy in the day? Hyperacidity, circulation problem, you feel tired very easily, you fall sick very often. If you have any of these, you have more free radicals in your body, which is oxygen deficiency, hypoxic, a minute hypoxia to the core. So these are the oxygen deficiency root cause, and when they get full blown up, you have disease. So that's why that reactive oxygen species is linked with every disease in your body. Be it diabetes, be it hypertension, be it circulatory disorder, be it aging, everything is related to oxygen deficiency. And to use oxygen in a particular way, you need a shift in thinking that you have to go from compartmental disease to holistic disease management. We are doctors, which are cardiologists, pulmonologists. Of course, they are very important. I'm not denying anything, but we have to look that they are connected. Your body is connected. It's not a compartmental disease, and you have to look or treat that the body as a whole. And to have that, you need good relaxation, good sleep, good diet, good exercise, and good cardio. But at the same time, you need good oxygenation. So this is what, I think it's a very famous slide. Many of you must have seen it because a lot of doctors who do nutrition use it. You are what you eat, digest, absorb, and metabolize. Is that what they write? But you are also what you detox and eliminate. And nobody pays attention to detox and the eliminate because we are not tuned for it. We feel that we are done. We slept enough, we ate enough, we exercised enough, done. But what about the detox? What about the taking away the free radicals from your body? And that is equally important. And that detox and eliminate is also related to oxidative stress and inflammation. So I think since morning you have listened enough about inflammation and oxidative stress. It is nothing but you are doing what you were supposed to do, in a faulty fashion. You were supposed to eat well, you were supposed to sleep well, you were supposed to work well, but we are doing all in the opposite direction. So oxidative stress and systemic inflammation is the culprit, and we need to fix that. And there comes the magic molecule. So what you just said. Ozone. So ozone is a part of O3, that is oxygen is O2, whereas ozone is O3. Many of you in this room think that you cannot live in ozone-rich environment. Yes, you cannot breathe ozone directly because your lungs do not have antioxidant defense mechanism. But the rest of the body of your normal cells have antioxidant defense mechanism, and that is the key. You cannot breathe ozone, but you can take ozone from any other air pathways that we do, rectal insufflation, which works on the gut, improve your liver, improve your gut dysbiosis, it enhances. We do IV ozone, like mixing with blood or giving it in through saline, that oxygenates your body. We have more than 20 different applications, and what do they give you? It activates your cellular metabolism, immune system activating, and regulates antioxidant defense capacity. But you cannot breathe ozone directly. It needs to be given in a particular fashion because you have to cross the bronchioalveolar lavage fluid. You cannot breathe ozone like you do oxygen. Ozone needs to be taken from the different ways because you want to improve cellular respiration and not the lung tissue respiration. Okay? And when you give ozone, it's not only ozone. It's a mixture of oxygen and ozone. So 99.9% to 95% is oxygen, 0.5 to 5% is ozone. So it's a very calculated dose. According to the different diseases, it is calculated, and that's how we give ozone therapy. And many of you might ask, is it new? Is it old? Why have I not heard about it? It is not at all new therapy. It was used in First World War. It was used or it was published in Lancet Journal, which is the highest medical journal, in the treatment of tuberculosis, empyema, and diabetic complications. It was also used in bronchitis, hay fever, and insomnia. Today in the world, or we are a part of World Federation of Ozone Therapy, today in the world, ozone is used in many, many countries effectively, where they have documented the very good results of it. India is part of it, thanks to Bisleri Charitable Trust. So how is ozone given? We have two ways of giving. One, which is chemotherapeutic, which works on reducing the antiviral, antibacterial load. And the other way is we are giving ozone therapy systemically, which is like through an enema, through a saline, or through mixing ozone with your blood and giving it as a major autohemotherapy. This gives you anti-hypoxic, which reduces. So your hypoxia is reduced, oxygenation is enhanced. It improves or it reduces your prostaglandin, so it improves or regulates your inflammation. At the same time, it does not do stimulation or suppression of immunity, it just modulates your immunity, it uplifts the immunity. So when we give ozone therapy, in the early phase with RBC, it improves your oxygenation in the body. In WBC, it does immune activation. With platelets, it improves your healing and the growth factors is improved. At the late phase, when we give ozone, it enhances the vasodilatation. So when you have a better vasodilatation, you have better circulation. At the same time, at the erythropoietic level, it enhances the formation of metalloproteinase. Basically, it mimics that. When it goes to the cell or bone marrow through the circulation, mimics that, it enhances the metalloproteinase. So you have better chemo characteristics of the RBC. At the same time, it upregulates your antioxidant defense mechanism. So the moment you give ozone, it dissolves in plasma and forming a gradient of H2O2 and LOP. So when you give this, the 6 major biological property of ozone. So when you take ozone, you have these 6 properties. And you may ask that why everything can be done with oxygen, because oxygen is used by every cell of your body. And oxygen is used as every cell respiration. So you will definitely get all the results according to the dosage of the ozone given to you. So regulation of prostaglandins, very important for healing. Improves oxygen metabolism, very important for circulatory disorders. Regulates oxidative stress, very important for improve your antioxidant defense mechanism. Immune modulation, that it improves your leukocyte performance, so that also enhances the immune modulation. It generates more ATP in the cell, so it has better cell currency. At the same time, it is wide spectrum germicide. So any infection, you take ozone, you can reduce the infection load, can be taken as a very good supportive treatment. So you can treat from rejuvenation, anti-aging, that's where we are. But you can also treat all the diseases, because the cell needs oxygenation. And if you repair that oxygenation, you can have better oxygen utilization. So these are the more than 20 different applications which we usually train our doctors with. And there are many, many, many clinics overall in India. I am from Mumbai, but in Delhi also a lot of doctors practice. We have applications according to the patient's requirement. It is patient-centric. It is not like one stool for everybody. It needs to be tailor-made. So what do we do as a prevention of this thing? So our protocol is based in eliminating waste, regenerate the liver, reactivate your immune system, restore enzyme, mineral and hormone base. And usually what we do is rectal insufflation, because gut dysbiosis is a major cause for any chronic oxidative stress disorder. At the same time, we do a lot of ozone steam sauna, which will address the skin and have better oxygenation. Now, is there we also do something called immunity prophylaxis tool. So you can give your patient, as a consumer can take ozone therapy along with vitamin B12 and D3 to improve your immunity. And this was proven in COVID time in our Bisleri employees. We treated 320 employees of Bisleri with these 2 sessions of vitamin D3, 2 sessions of B12, and 8 sessions of ozone therapy. And we tagged them for 9 months. Out of these 320 employees, only 7 got COVID. And that was the 98.9% of effectivity of ozone therapy having immunity building. This is one of them, so this is what we do. Step 1 is ozone therapy and step 2 is antioxidant infusion. We do this for improving immunity. At the same time, same group of people, so sales executives of Bisleri, 34 employees were taken. They were all in their pre-diabetic stage. Their HbA1c was ranging from 6.5. Like in India, it is pre-diabetic, okay? Nobody does anything till it is beyond 7.7. I mean, you all will agree. Okay, so they were taken, their blood sugar, random blood sugar was from 87. So 140 to 87. Whereas blood pressure was always high, they could not sleep well, there were no energy, and fatigue, acidity, heartburn. So this is like a common sales executive on the go, right? So these were treated with rectal insufflation, ear insufflation, and 500 ml of ozonated water drinking in the morning when they would come for work. This was given for 20 sessions. So nothing in ozone is like one magical pill, one day you take, you become all right. No. We are giving a natural molecule which is in gas state for benefit of your body. It has to be done consecutively. So the 20 sessions were done. Symptom improvement we saw, then fatigue, insomnia, acidity reduced pretty fast. Work performance improved, but after 3 months, so this was planned alternate day, so Monday, Wednesday, Friday. This was planned for roughly 20 sessions, was for 2.5 months. We checked their HbA1c. After that, it had reduced to 5.5 to 6.5. So we see that there is decrease in HbA1c after ozone therapy. At the same time, they could do their exercise better, they could perform better. At the same time, we saw the reduction in the blood pressure also. So this is this was done, of course, like in 2008. But we also saw there was decrease in blood cholesterol levels in cardiac patients treated with intravenous ozone, and that also works very well to reduce. So we usually do not put our patients, who come to us, we put them on ozone therapy, we put them on niacin, we put them on omega-3 and little exercise, little workout, little meditation, calming down, everything together, they improve very well. So what are the precautions for not taking ozone therapy? Very important that if you have G6PD deficiency, which is a blood test, you can come to know that if you have G6PD deficiency, we cannot give IV ozone to you. At the same time, hyperthyroidism, thrombocytopenia, menstruation, if you have sudden, alcohol intoxication, we don't give ozone therapy to these people. First, we give them the counseling and then we start once they are into normal category. So what is the take-home message? Everybody can take ozone. Who are sitting here, whoever at home you feel they need, you can take ozone for the promotion of health. It is something like improving your cellular respiration, eliminating detox or eliminating toxins, and rejuvenating your cells with better cellular respiration. Individuals with high stress levels, sedentary lifestyle, smokers, substance abusers definitely can take ozone. There is nothing that can stop, and it will enhance only. Children of diabetics, so type 1 diabetic also can take ozone to improve their beta cells viability. It works extremely well. We treat a lot of autistic children, lot of CP children, because the main is inflammation in their body. So we have a lot of protocols for them. You can use it as a protective tool. You can use it as a treatment. You can use it for control. So it can use in a different way. At the same time, people like us who are high health conscious, who want to remain anti-aging or ageless, you can always use that for improving your biological properties. And when we are promoting ozone therapy, we are promoting it as a natural integrated. So with the effort of Ozone Forum of India, we have approved ozone therapy under naturopathy, where we do certification programs for doctors under National Institute of Naturopathy. So we have got it registered under naturopathy because it's a natural gas. It is not a chemical. It is not something which is, of course, you have to make ozone with the oxygen, but it is a natural gas and given as a medical gas inside the body. It is integrated naturopathy, very cost effective. It is drugless, no chemical, no toxins, faster recovery, better results. And it can be combined with any treatment. You don't have to go back to your physician and ask whether I should take ozone, because you're taking an oxygen molecule in a different way. So these are the holistic, affordable, natural healing treatment. At the same time, we can use in multiple diseases, from diabetes, infection, lifestyle disorders, cancer, pain management, and autoimmune, and to be best for anti-aging and living properly.